Hey guys, we got Joe here again. We're gonna go ahead and go through a bit of an ankle assessment. See a lot of ankle injuries within the office, whether that's through an athlete coming in after rolling an ankle, or just some chronic onset of ankle pain that can occur over time. And so I'm just going to show you a little assessment here and a little treatment, and we'll just kind of let you guys learn from this. So first thing I always like to do with patients, obviously, is get a detailed history. Was there an injury? Did this occur insidiously or just without injury over time? But let's say that we have someone come in and they just rolled their ankle, and we're going to take a look at it here. So first thing that I like to do is just inspect the ankle and see if there's any bruising, swelling around this area, anything indicative that, hey, maybe there's a fracture within one of the bones or a tear within one of the ligaments in through here. Let's say we clear all of that first. I like to go through a little bit of range of motion. So what we'll do here is take the foot all the way into what's known as dorsiflexion, or where the toes come closer to the shin there. Okay, we'll bring them all the way into plantar flexion. A lot of times this will be a little painful if there is any sprain there, so we got to be careful of that. And I always like to take a look at any sort of inversion, eversion here, okay, making sure that, again, no real pain or anything. Now, if it's someone who's just coming in and they have tight ankles and they just need a bit of release in through there, there is a joint right in through this area, right where the ankle meets the foot, called the talus. Okay, and so this is something that I adjust very regularly, and it's a quick, simple adjustment where we can bring the foot up just like this, bring it into a little bit of dorsiflexion, and then just give it a little pull, just like so, right? And so we can get that moving pretty nicely, and that will help with efficiency while running, while squatting, anything where you need this motion of that toe going up towards the shin there. Okay, now a lot of the times if there is a sprain in there and we have a bunch of swelling and fluid buildup, we got to get that moving somehow, right? So Graston is a great technique for that. We also do dry needling therapy a lot within the ankles, flossing technique, which we saw in another video as well. But I also like to utilize KT tape or rock tape as well with this. So if we had an inversion ankle sprain just like this, all right, and it is painful to move it side to side, sometimes a little strip of rock tape will help with that. But then also it will lift up on the superficial layer of skin there and provide that blood flow that might be pooling in this area with the swelling and the bruising there, and I'll just kind of get it moving a little bit better there, right? So I'm going to show you just a quick tape job that I'll utilize with my patients here, and we'll apply a little rock tape here. So what we'll do, if we had an inversion ankle sprain here, we'll start just on the inside portion of the ankle here, just along that medial malleolus, or the bony part of the inside of the ankle. Okay, we'll place our tape here, and then we'll go ahead and cut another strip because that one's not big enough, and cut another strip because that one's not big enough. So if we are going to tape the ankle here, okay, we're going to start right along the medial malleolus, okay, or that bony part of the inside part of the ankle here. We're going to get our strips set. We're going to make sure that we don't have any wrinkles as we go underneath the foot, and then we're going to provide just a little bit of stretch here. Now this isn't going to necessarily hold like you would athletic tape, okay? It's not going to create a lot of stability within there, but it is going to create some proprioceptive aspects where your body's going to be aware of it. It's going to lift up on that tissue in through here and provide a little bit of blood flow through there. So there's a little tape job that we do. Okay, and usually that is following some of our other therapies. So there's a quick ankle assessment and some treatment for you. If you guys have any questions, please reach out.